Every health service in the world faces the same problems. The problems are failure to prevent disease, inequity and inequality, waste of resources, harm to patients, and variations in access to care, in quality, outcome, cost. These 5 problems, these are the 5 giant problems of healthcare, and I see them in every system, in every country. Tax-based systems, insurance-based systems, public systems, private systems. Structure is relatively unimportant. The mistakes we've made in the NHS have been helpful to us. We're learning from them. And in looking to the future, and I'm full of admiration for what you're doing in China, in looking to the future in any country, I think there are 3 important principles. Firstly, we need to think of value. Now, I'm not sure how value translates in your language, but I find in every language I've discussed it with, value means the same thing. Value for money. Farmers know what it means, fishermen know what it means, and patients and people who pay for a health service know what it means. Value is the relationship between outcome and the resources used. We need to reduce the number of lower value activities and increase the number of higher value activities. And you will see this even though you're not at the moment spending the same proportion of your GDP, you will see lower value activities, the growth of imaging, for example. So value. The 21st century is about value. Of course we need high quality care to increase the chance of a good outcome, and we need safe care to decrease the probability of a bad outcome, but it's all about value, about the balance of benefits to resources used. So that's the first point, value. The second point is systems. And when we're running workshops now in England, we ban the use of the words primary and secondary, acute or community. We use words systems, networks, pathways. Systems, networks, pathways. A system is a set of activities with a common set of objectives. For example, a tuberculosis control system, or a system for people with heart disease. Prevention, diagnosis, treatment by generalists, treatment by specialists, cardiac surgery. It's all part of a system. So, systems of care allow us to identify where value is being lost, the lower value activities. Systems of care. And systems of care require you to relate your activity to the population served. Either a geographical population like the city of Shanghai, or Chengdu, where I've been, the wonderful city of Chengdu, or the population covered by an insurance company. You've always got to relate the activity to the population to understand the value. Remember, if resources are being wasted, it's not the government's money that goes, it's other patients that suffer. So, the first principle is think of value. The second principle is think in terms of systems, not hospital and primary care, but systems of care. The third principle is to change the culture, to change how patients think and how doctors think. You see, the 5 problems I mentioned, which you see in every system, they require not a change in the way in which you finance or organise your health service, but a way in which the doctors think. You have to influence the doctors, change how they think. And I've been in workshops in China where I've been looking at ways in which we can change how people think. Now, how do you change how people think? One way is to get them to use a new language like systems, networks, pathways. The other approach is program budgeting. So if we take the cardiologists have to understand that they're working within a program budget for heart disease, and they're responsible for it. Not the government or the person in charge of the insurance company, but the clinicians are responsible for the resources that they use. So those are our 3 lessons. We've still got many problems in the National Health Service in England, but focus on value, the relationship between outcomes and costs. Think in terms of systems, not hospitals, and focus on the culture, on how doctors and patients think. You have to reach them and change the way they think. I'm very sorry I can't be with you, but there's probably no one in the world whose opinion I value more highly than the opinion of Professor Mully. So my best wishes to you in Dartmouth.